Hi, my name is Karen Harris. I am here to perform a postpartum head to toe assessment of a mother that just had a baby. So before I came here, I closed the window, I closed the door and the curtain for privacy. I already asked the patient's name and date of birth, and I performed the vital signs. They're all in normal and within the normal limits. The temperature is 98.8. The BP is 120 over 80. The heart rate is 75. And the oxygen level is 100. I am here. I'm looking at the patient, and the patient has a normal skin tone. There is no visible wounds, visible um, bruising. There is none in the front, and I'm checking because I am checking the skin of the patient. I also check the limbs of the patient, and the capillary refill is within limits, and it bounced back to less than 3 seconds. And I both checked the limbs of the patient already, and the patient is also breathing well, and it's not having any hardness and difficulty of breathing. So I am now gonna check the patient um, breast, which is I'm gonna open it now, and I'm looking at the patient's breast. They are everted, and both are everted, and I'm palpitating, touching the around the area, and they are not tender, they are not swelling, both are looking normal. And I asked the patient if she feels tenderness and pain around the area, and the patient answered that she feels normal. So I am also educating the patient on cleaning the area. I told the patient to use a wet cloth around and clean it thoroughly. So now I am gonna proceed to the um, uterus area of the patient, the breast after the breast area. So now I am gonna palpitate, and the fundus is at the umbilicus, and it is firm. So I am feeling the skin of the patient. It feels warm, and the skin is normal, and it is, and it's not sweating. There is no visible diaphoresis. And now I am gonna listen to the patient's bowel sounds. Bowel sounds are normal and active. And now I'm gonna proceed to the bladder of the patient. And I asked the patient if she went to the bathroom already. And the patient did went about an hour ago. And I asked the patient also how many times did she change her pads. And the patient answered she changed it one. And I am checking now the perineal area of the patient. And by the way, the patient was able to go pee and urinate and it was yellow colored, normal, a little reddish, and the patient already disposed one pad, and I'm checking the Lucia of the patient, and it is rubra, and I don't see no swelling in the perineal area labia of the patient. And by the way, I'm gonna repeat also. I see there is no distension in the abdominal area of the patient. And the patient also said that she feels normal and was able to go poop about um, 6 hours ago. And she feels hungry. Um, so the patient was able to void. So, so the color of the Lucia is red, Lucia rubra, and it's been changed an hour ago when the patient went to urinate in the bathroom. Um, there's no foul odor. There is no foul odor coming from the vaginal area of the patient, and there is no visible clots in the patient's perineal area, and the uh, Lucia didn't. There is no visible clots. So I am gonna check the perineal episiostomy and laceration of and hemorrhoids also from the patient. So I'm gonna turn the patient sideways. So there is no visible laceration, and there is no swelling, there is no discharge. It looks very normal, and the patient don't have no hemorrhoids also. It looks pretty normal from the backside. I don't see any abnormalities. So I'm gonna lay down the patient again, and I'm gonna check the lower extremity of the patient with my bell. I am gonna check the deep tendon reflexes with my bell. It is normal. And I'm gonna check the clonus reflex of the patient, which is also normal. And um I forgot, I will mention that in the perineal area I did check for RIDA, redness, ecchymosis, edema, um discharge also, and they all both look normal. So I'm gonna go ahead and I check the deep tendon reflex and the clonus also in the leg. I didn't, the skin feels warm. Um, I don't see no edema in the legs. I did check for the toes um capillary refill, and it's within normal limits, under 3 seconds. And I checked the um I also checked for the pulse in the foot of the patient, and they are all feelable and palpable, and um, they are also within normal limits. And the color is pink and normal. And so if the patient's emotions, I'm asking the patient, how does the patient feel? I did ask from the vital signs how much her pain, and the patient is just a little bit comfortable, but no pain. Um, um, it's a general pain, which is uncomfortable for like 2 in the scale from 1 to 10. And I asked the patient if how she's feeling, and she said she's eager to take care of her baby, and it is very good. And if the patient is in a cesarean section, I will assess for the incision site, which is it is dry and clean and intact. And the bowel sounds and four quadrants feels it is normal, and there is no tenderness, there is no distension. And I ask for if the patient um, um, catheter, it has yellow, clear yellow fluid on it, 50 cc, within an hour, because it was emptied a little bit, and it was a total of 200. Um, there is no sign of infection in the incision, and I am um, educating the patient on cleaning the for discharge, and how to clean the um, keep the incision clean, and the breast area also. And I'm asking the patient if she has thoughts about hurting her baby, and she said no. And the patient didn't have any signs of seizure, no obstructed breathing. There is no redness or swelling in the incision part, and there is no swelling also in the breast. Um, so I am now gonna take off my gloves and clean my hands, and then get the patient comfortable, and that's the end of my postpartum um, um, assessment for the patient.